morning, Wolford Health Centre. How can I help?
You had this sort of tightening of the foreskin. Can you retract it back to go for
Not
a
at
wee
all.
or anything like
Not
that?
at all.
See, I'd say they look like bites.
Any idea from what?
You know, where do we go as a family to try and get him the help and support he needs?
Are you normally generally fit and well?
No, I'm bulimic.
Does that hurt there?
Yes.
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing something.
I actually found her in the hallway of the house. She was still alive, but only just, and she died 3 hours later in hospital.
Good morning, Wolford Health Centre. Sally speaking.
John Ferguson, please. Hello.
Hello there.
Come and have a seat.
All right, good morning to you.
Good morning.
On Saturday, I went to the loo and had to strain to produce any stools, as it were. And when I got up, I noticed there was quite a lot of blood in the bowl of the loo. But since then, my stools have been quite loose and I've been able to go to the loo normally. And there's no blood in the bowl, but when I touch it with the toilet tissue, there's still a witness of blood. My ex-wife has been a nurse for 40-odd years, so I phoned her up and she said, well, that sounds like a hemorrhoid.
Any history of any bowel problems in the family at all?
No, not at all.
Pop yourself on the bed. I want to feel... I'm going to feel your belly and then I'm going to feel in your bum.
Wolford Health Centre, Sally speaking. Yeah, what's your date of birth, please? 14th of March, 1974. And what's your name, sir? Oh, sorry, I'm giving you 20 years there. That's not very good, is it? God, 43, that wouldn't put you out. That's not very good, is it? Exactly.
I'm Dr. Graham. I think we have met before.
Yes.
Yeah?
Got
How
the
can
same
I help?
first name. Well, in a playful way, my cat whacked my eye,
Right.
and it's been really painful.
You're a bit swollen up all over your cheek, really, aren't you?
Yeah, like here, here,
Yeah.
oh, there.
OK. Is it getting worse?
Yeah,
Yeah. OK. Do you feel...
like
yeah.
it's sort of puffing up into my vision. So.
Yeah.
Let me just have a feel here.
Oh,
Yeah. New bit swollen there.
yeah.
OK. All right, let's just look at the eye area. OK. Close your eye. OK. I think what's happened is that when you were scratched, it's maybe if some bugs have got in under the skin and it's a little bit infected. So that is called a cellulitis, OK? So I think we should give you a short course of antibiotics. And you're not allergic to anything as far as you know?
No.
No.
Why is there a picture of Henry VIII in here?
Good question.
Because he's a bit of a bastard, really. Isn't he?
That picture was done by Holbein, but it was copied by my great-aunt. So I know who the artist was. She has died since then.
He was like, I'm going to kill loads of women.
There you go. OK, Anna?
Thank you very much, Anna.
Pleasure. Bye-bye.
Bye.
Big breath in. Point your bum at me and then draw your knees up. The key is to try and remain as relaxed as you possibly can. And the way to do that, I always say to patients, they laugh, but the way to do that is to open your mouth and breathe gently in and out through your mouth. This shouldn't hurt. Relax. And just... No, keep, that's right, that's right. No, I can't feel anything I missed there. Just stay there. You can pop this, when you're ready, get your breath back and then get yourself dressed. Sit yourself down. So what this is all about, I have to tell you,
Okay.
is the possibility that this might be a cancer being there, not anything else. And the figure that they've chosen is if you go on bleeding for over several weeks.
All right, well, no, it stopped. Now I've been able to go to the loo and it's not bleeding at all. So.
Well, that's very good. So, yes, I agree with your sister.
My ex-wife.
Your ex-wife. Sorry.
No, don't worry.
So that's likely to be a haemorrhoid inside that's bleeding a little bit. If you get a bit of bleeding after you've done the poo.
No.
After you've defecated, and then you're wiping yourself, as you see blood on the paper, that's very likely to be a haemorrhoid.
Okay, well, that's what's happening. Right.
Otherwise, I couldn't find anything abnormal at all.
Okay, good.
So I'm sure the right thing is to wait and see.
Okay.
How are you?
I'm so.
You've had lots of contact with your psychiatrist, haven't you? And I've had some with Vicky and...
I want to talk about that first of all. Hello, they had internal meetings, which I wasn't part of. I'm frustrated that they just don't seem to listen to me. Nobody is addressing the issues of what keeps me in the traumatic circle. Trauma, and you know, it's me trying to grab things that are there, like the sanctuary, like women's groups, things like that, and try and focus on moving forward. But my symptoms, my trauma, my flashbacks, my nightmares, my insecurities, my depression, my anxieties, this has not gone away.
So you've just got the 2 spots now, have you? And nothing else?
Yeah, this one's only small.
Tibanos has got a rash on his right leg. My arm has got, like, real bad.
Right, OK.
So, concern is, it was a mole and now it's changed.
So an itchy patch?
Yeah.
Yeah. Oh, yes, just here.
Yeah.
Yeah.
Come on through, Jeffrey. So we had a chat about this yesterday.
Yes.
Saw you in November, December, when you had this sort of tightening of the foreskin.
That's right.
But you could get it back, and I referred and it got rejected.
Correct.
But since that time, it's got worse.
Definitely.
And what can you do? Can you retract it back to go for a wee or anything like that?
Not at all. There's no retraction at all.
Mm-hmm.
And it's getting a little bit embarrassing because obviously there's no direction.
So does your wee come out does it spray at all or?
Yeah.
Okay. Okay. And has there any skin change on the tip of the penis that you can see?
There's colour change.
There's a colour change.
Yeah.
And when did that develop?
Well, it's been developing since it hasn't been able to retract.
Yeah. Yeah. Okay.
Hi, Glenn, it's Rose. Hello, I don't know what I've done, but my screen has completely turned around.
Let me just try and see what they're trying to do about it. Say that you feel down and persecuted. So many different services, it's difficult to keep track of who does what and what you can expect. They also think that your expectations of services may be unrealistic.
Only expectations I have of services if somebody is offering me something that it actually happens.
Yeah.
Because it's not happened. It's not happened. Okay, now I want to talk a little bit about the gender situation. Okay, I'm going back to Laurel's, right? I was told last time I brought it, I had to wait 2 years to put the application in for the gender recognition certificate. So it's 2 years come now. But when I have to talk to both my psychiatrist there and you, because to go before the panel, I need my GP and I need the psychiatrist agreement letter. Are you happy to do that?
I think you should talk to the Laurels first and go because they will obviously know much more about that than me. But if they're saying that the situation is right for you, then yes, I will be able to confirm that.
The second thing, I'm in the position to go forward for surgery, for breast surgery, yeah. But the surgeon that I had the consultation with.
But you've had a consultation.
I've had one consultation. Okay. She's now sent me away with 2 things that she'll require from me. You know, I'm working on my weight loss anyway, and I'm consistently working on that. So that's part 1 thing. Good. And obviously the second thing would be my GP to say that they're happy for me to go ahead.
I don't see any problems with this, Valentine. OK? All right? So speak to the Laurels about both those things. OK? So we've got a plan there. All right?
Yeah, OK.
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 All right. OK.
Thank you.
Bye-bye now.
Okay,
bye-bye.
Yeah, bye.
What have they done? It did, it went off like that, and then it... Ah, well done. Thanks, Glenn.
So, sorry, Jeffrey, I just need to... Can you see what you can retract yourself?
Yeah, sure. There's nothing at all.
There's a whitish skin change there, though,
Yeah.
isn't there? Yeah, fine, OK. Let you pop your things on and get dressed. That's OK. I think you've dropped a couple of copper pennies there.
Oh.
Right. Well, obviously it needs sorting out. I think what's going on is something called BXO, which is a kind of skin condition that over time in your sort of age group leads to just the tightening of the foreskin, exactly the kind of symptoms you describe.
Yeah.
And so that needs acting on pretty quickly, actually. Haven't seen a case for a while, actually. BXO stands for balanitis serotica et obliterans, and it causes thickening of the foreskin and depigmentation. This presents with symptoms of poor stream when you're passing urine and pain during intercourse. It's relatively uncommon, we don't see it very often. Medical options are using steroid creams, which sometimes help, but unlikely in cases where they're occurring in older age groups. Usually the definitive treatment is surgery, which is often a circumcision procedure. Does it itch at all?
Every now and again, I get that really it itches inside.
Yeah.
And you can tell it's quite hard skin at the top end.
Try and keep the area dry. The other thing is just to book in for some blood tests. I just want to check your sugar level and a few other bits and pieces because you haven't never really had any blood tests.
No.
So if you take that along to the treatment room, they'll book you in.
Yes.
I'll speak and sort out the urology referral again.
Yes.
See what we can do, but it's more urgent now.
Yes.
Remind me, do you smoke at all?
No.
You've never smoked?
I gave up when I was 10.
You gave up when you were 10?
Yeah.
Should I ask how old you were when you started?
About 8.
Were you just trying it or smoking proper?
No. My friend and I used to go down to Central Park in Plymouth.
Right.
Because my dad was in the Navy, so there's 60 a day, so there's cigarettes everywhere.
It was freely available.
So we used to just go into the park with a packet of 10 and a bottle of lemonade.
Then muck around.
And then when I was 10, Steve decided to drag one down, and I thought, no, I didn't like that.
Didn't like it, so it put you off for life.
Yeah, definitely.
OK, well, there we go. All right, Jeffrey.
There's not too many people who say that.
No. I'll speak to you a bit later.
Brilliant.
All right, we'll get that sorted ASAP.
Lovely. Thanks very much for that. Brilliant.
Take care.
Thanks a lot.
Bye.
Hello, reception. Hello, all right. Yeah.
Thank you very much.
Yeah.
Thank you, darling. See you later.
Okay, I've added it on for a phone call, but it can be any time between now and when we close. All right. Thank you. Bye.
And what's brought you here today?
So she has, I can only describe it as a rash on the back of her neck.
Okay.
Which is a lot more fierce and flared than any that we've had before.
Right, okay.
But we don't know what they are, and we can't work out why she keeps getting them.
Okay, and has she been well in herself?
She's well in any other aspect.
Right, okay.
Looks that might be our animals, our 2 cats.
You got 2 cats, have you? Okay.
Put them up.
And do they get regularly treated?
Yeah, this is the thing. At one point, I was getting to the point where I was hoovering mattresses and...
And have you actually treated the house as well?
Yeah, I've sprayed the house.
Let's have a little look at your neck.
Stand up then, sweet. So that's the worst I've ever seen them.
How do you sleep? Are you in a duvet?
Duvet.
And do you have
You wrap yourself up in those little woolen blanket things.
a night dress or
No, she's been sleeping in her vest and underwear
vest and
recently.
underwear? Okay. See, I'd say they look like bites.
Okay. Any idea from what?
Could be flea bites. That's what it looks like to me.
Because I've literally stripped everything. I pulled everything out of her room and hoovered the lot, sprayed the lot, and then the cats are defleed every 4 to 6 weeks.
The only way we can do it is, again, suggest treating the house and maybe this blanket as well, really.
Is there anything that I can do to make that go
To
down?
stop it itching, she could take an antihistamine.
OK, well, we've got that at home, so that's all right. Right, we're stripping your bed, we're boiler washing everything, we're spraying the hell out of your room. Everything that lives in your room is dead by the end of it. See, cats, bad idea. Bloody things.
Hello, I'm Dr. Bolam. Right. So, how are you?
I'm good.
Yeah. So tell me what's going on. You weren't living at home, were you?
No.
Is that right? Just tell me a little bit about that.
I used to live in care, and I was with a carer since the age of 8.
Okay.
So then I decided to tell my social worker that I would either run away or you could put me where I want to be. So I ran away from Cornwall and legged it all the way up to Bristol. But I didn't tell my family where I was for like a whole week until
Where were you?
House hopping.
Okay. So what's happening now then? What, social services know where you are.
Yeah, I'm living with Mum at the moment.
Okay. So what can I do for you today?
I have ADHD, and I take 80 grams of methylphenidate hydrochloride every day.
Okay.
And sometimes it feels like my emotions get locked away in my head, like no emotion will come out sometimes.
Let me get this straight. Are you here today to discuss this, to potentially change it?
Yeah.
Right. Okay. We need to
Why
think
were
about
you
that.
told to come here though, Leanne?
Because I took an overdose on my meds.
How many did you take?
I took 10 of the 5 milligram ones. So it wasn't like my normal high dosage, but I hadn't had anything for a couple of weeks with my meds.
Okay.
And then I had loads of them.
Let me get it straight. You've been off it altogether for a couple of weeks?
Yeah.
Because you'd run out?
No, just because I don't...
Just didn't want to take it?
Didn't
So
take
for
it.
like 2 weeks you'd had no methylphenidate at all?
Yeah.
And then you took 10 5 milligram ones?
Yep.
So that was 50 milligrams?
Yep.
And what you told me a minute ago was quite often you take more than 50 milligrams in a day anyway. OK, this needs sort of straightening out, OK? All right. I want to see if I've got a letter from your community paediatrician, OK?
Yep.
So what they write is that you should take 50 in the mornings and then occasionally take a 5. What they're saying is in the context of you needing to kind of concentrate.
Yeah.
OK, that's what they say. Now, if you're talking about feeling like you've taken too much, maybe that's the solution.
Yeah.
You take 50 in the morning.
Yeah.
And then you just use these if you... I mean, you're not doing homework now.
No.
Maybe you don't take these at the moment.
Yeah.
Do you need some counselling? Are you under thinking aloud? Do you know what thinking aloud is?
Don't know.
Shall I write that down for you?
Yeah.
OK, it's support for all children in care, all right?
Yeah.
But I would think they should be aware of you. They should be aware of all children who are looked after, which is the sort of fancy name for being in care. OK. And you're feeling a bit better now?
Yeah.
Is that all right? Yeah. OK. It's nice to meet you. So do you think you're going to be staying in Bristol then?
Hopefully, yes.
OK, good.
Yeah.
Excuse me, there's no phones in here, my sweetheart.
David Parfitt, please. Hello there.
Good afternoon.
Sorry about the wait. Come on
that's
through.
okay.
Come on in, come and take a seat.
Thank you.
I'm Dr. Ahmed. We haven't met before, I don't think.
don't believe we have.
No. How can I help?
Well, here's the thing. My mum died last week.
Oh.
And I've got 50-odd years of stuff to sort out.
Was that an expected death, or...?
No, it was... Well, she was 81 and had been suffering, but, you know, it wasn't really expected. I actually found her in the hallway of the house. She was still alive, but only just, and she died 3 hours later in hospital.
And where are the pains?
So, I mean, it's still like my legs still feel a bit tingly on occasion.
I've got problems with my knees.
Both of them?
Yeah.
I've had sort of on and off pains in my big toe joint.
This knee's been playing up a lot lately.
It's more when I bend over.
Any numbness or tingling?
No, I've just got pain right down to the fingers.
I don't think I've met you before.
No, I'm
Yeah.
William.
Hi.
Hubby, obviously.
OK, so what are we doing today?
I went to the hospital weekend, Monday, wasn't it, with the arthritis. Woke up with terrible pains in her arm, as
Right.
per usual.
Yeah.
Went to A&E for 7 o'clock. As soon as they opened, we like to get there on time. And the usual thing, I mean, Grace keeps thinking they're going to do something drastic. But,
Yeah.
you know, because once she had a morphine terrible, injection in the leg.
Yes.
And I think she thinks they're going to do that every time.
Yeah.
So what they did was give her extra strong painkillers.
Oh, yeah.
So
And she asked me to that she was letting you know, isn't it? Oh, that's one, isn't it?
Yeah.
Some codeine.
Codeine, just to say double strength or something.
So you're affected in lots of bits of your body, aren't you?
Yeah.
Got to learn to slow down. Because as
Which
soon
I
as she
have
has a
been.
good day,
Yeah.
she's out in the garden and she'll move and pull
Yeah.
things about.
But I guess you've got to do what you've got to do, haven't
You
you?
just forget.
Yeah.
You
Yeah.
think you're okay
Yeah.
today, you're doing
Yeah.
it, washing big elms.
So, show me, with your hand, show me which bits are really sore.
Well, what can I say all round here?
That joint, so
And
that
which?
bottom bit there, yeah?
Yeah, oh yeah.
These bits here.
Yeah. And the other one was the elbow and that.
Right.
Sorry, started
Yeah.
from the elbow and went
Yeah.
right to here, and then all
Yeah.
of a sudden...
I mean, the
tap the
most
hand.
likely is that this is the sort of arthritis caused by sort of wear and tear, osteoarthritis. But it is, you are quite bulky here, and
I
it
did
is
say
quite
this morning
tender.
to you, didn't I look at that bit?
And your
My
wrist
eyes
is
are going
quite
this way.
swollen, yeah? Does that hurt there?
Yes,
Yeah.
it
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing a different sort of arthritis, OK? Which might need a slightly different sort of treatment.
Right.
OK?
Grace is thought to have osteoarthritis, but when she came to see me, her wrist seemed a little bit unusual for that condition, in that it was swollen and red and tender. And so I thought I ought to rule out an alternative diagnosis like rheumatoid arthritis.
So if you have the bloods done at some point, maybe in a couple of weeks, and then book to see me a week after and we'll discuss the results, I'll give you some of these with paracetamol in, and we'll see how you are.
Osteoarthritis is the commonest form of arthritis. It normally affects the large joints, such as knees and hips. Rheumatoid arthritis affects the small joints of the hand as well as larger joints. The main difference between the two arthritises
is that rheumatoid arthritis unfortunately destroys the joint. So it's important to make the diagnosis early so that you can be on medication to prevent that from happening.
There we go, that's gone through to next door.
Right,
Okay.
that's super, yes.
All right, there we go. You
They
take
go
that
through
back.
and
Do you want to put that
that's
back in
it.
there?
Yep. Put your hand back.
And that's for you to make an appointment to have the bloods done and see me afterwards. Okay?
Okay. Okie dokie,
Excellent.
that's fine.
All right.
Yes.
Yeah, go ahead.
Dr. Boma.
Bolan?
Boma. Is it Boma?
Dr. Bolan, yeah?
Is it Bolam?
Yes. Is that who you
The
just
lady
seen?
I just saw, yeah.
Let's have a look. What's your date of birth?
16th of July, 1957. 57.
Sorry, 16th of July, 19...
Don't say it loud.
Oh, sorry.
My mum died last week.
I'm sorry.
Yeah.
That's quite a shock for you, isn't it? If you
Yeah, and I kind of...
just popped round to see her, presumably, or...
I had a weird feeling. That was the thing. I'd spoken to her the night before, and she was a little bit out of breath, and she was clearly a little bit confused. I don't know. I tried ringing her in the morning, and she didn't answer. That's not unusual because she's out feeding the birds or shopping, or a very active person. Tried her again after lunch. Didn't answer, and I thought that's unlike her. And I just had this horrible feeling. I don't know. I can't really explain it. It's just one of those.
Sixth sense.
Yeah. So I went there, and I was so glad I did because she was still alive, albeit breathing very shallowly. That's such a word. Yeah, and she's, you know, unfortunately, she died in resus in casualty.
And have you... what I find is that you... When you're busy with it all, it's OK, and then sometimes after things settle, it hits you what's happened. Because there are moments that you feel absolutely fine because you're busy, then you feel guilty about feeling fine, then you feel sad, then you know, so it's a whole mixture of emotions.
Yeah.
And I think it's a normal pattern.
Yeah, I'm going through the what if sometimes. I think, oh, what if I'd gone round there that night?
Yeah,
She was clearly in trouble, and I didn't pick up on that.
You couldn't have changed anything. We've all got our time, haven't we? We're all here for a limited time. That's the only certainty, actually.
Yeah,
so,
that's very true.
You know, and actually you acted on an instinct there anyway to go around in the first place. So you got that last bit there.
I was glad I was with her, let's put it that way.
Yeah, that's right. That's right.
Yeah.
So, I mean, the whole sort of bereavement reaction's quite a process, really.
Yeah.
But come and talk to us about it.
Okay.
We also advise, I mean, and it's entirely up to you, but you can always contact Cruise, which is a bereavement counselling service.
Oh, OK, I didn't know that.
I'll give you their phone number. Sometimes it's helpful to talk to an objective person who's not friends or family.
OK, that's brilliant, thank you.
Yeah.
Thank you very much.
That's all right.
Right.
Take care.
OK, thank you. Thanks very much.
Bye-bye.
Bye.
Bye-bye now.
Bye.
Oh, is somebody making coffee?
I don't drink tea or coffee, so...
I think that's a terribly good excuse. I don't know how to boil an egg, I never eat them. I don't know how to cook meat, I never eat it. That would be all right, wouldn't it? That would strike a rather high moral tone, that one.
Laura Smith? Hiya. Come in. Have a seat, all right? Right, how can I help you?
OK, so, recently, well, over the last month or so, every now and then I get this horrendous pain. Like, I don't know where it is, but it's more like here. And I can't tell whether it's in the front or in my back. And if I'm quite honest, I got a query of what it is, and this is only because my mum said she had it. She thinks it's gallstones. Because my mum had gallstones and she had to have, when she was my age, and she had to have her gallbladder removed.
Okay.
But I never told her about these pains, and my mum's saying you've got to go and get it looked.
When did this all first start, then?
About a month ago. I would almost say it's constant because I'm getting like a dull ache in between now, do you know, between the attacks. I can feel something's hurting me.
So it's happening every day now?
Yeah.
Are you normally generally fit and well?
No, I'm bulimic, yeah.
Okay.
But I am well, but I am a I've been bulimic for like 10 years.
Okay, so what's your diet like at the moment?
I don't binge eat so much, not anymore, but I do throw up every time I eat.
Do you think it's related in any way to having an empty stomach and not having eaten, and then do you think that it's at all relieved by then eating?
Probably.
Probably.
I don't know.
The other thing...
My eating pattern is just so ridiculous. Sometimes I can go 2 or 3 days without eating.
Okay.
And then I can just eat normal, or I might binge eat, or I have no consistency to my diet.
Right, let's have a feel of your tummy then. If you just have a lie down on the couch for me a second. Let's have a feel of your tummy low down here. And have you been passing urine okay?
Yeah.
No burning, stinging, pain?
No, not that I've noticed.
Any pain there?
I don't like that.
Don't like it, but not painful though?
No. Yeah, that's right. More just uncomfortable.
Okay. Right. Come and have a seat again. So, have you been emptying your bowels okay?
I never do. No,
At all?
I can't have a bowel movement without using a suppository.
Right, OK. So it does sound like it could be gallstones. The other thing would be something like a stomach ulcer. Have you ever had any acid reflux or a feeling of, like,
I always get that, yeah.
Have you ever told anybody about that?
Well, no, because I always thought that was a bulimic thing. Like, you know, that I just assumed in my head that because I'm eating, throwing up, my stomach's producing acid.
Yeah.
And then I'm throwing up the food, and so I'll have excess acid. So
Which you will do, and that logic makes sense, but the problem is the fact that the acid is then there in an empty stomach, so the acid can be breaking down the lining of your stomach, giving you a stomach ulcer. So start with this, because this could make a difference. If it is a stomach ulcer, this should really help.
Okay.
But what I want you to do before you start taking them is a stool sample. You're not going to be able to do that, are you?
No, it's not going to happen.
The reason being because sometimes there's a bacteria called H. pylori that can live in your gut. Loads and loads of people have it, and quite often it doesn't cause a problem, but it can start to cause you problems with heartburn, indigestion, acid reflux, things like that. So if you manage to
Yes,
go,
I will try.
bring that back for us.
I always try, if I'm honest.
And then make an appointment to come back and see Dr. Pelly, and then he'll be able to look at getting a referral to do whatever tests they think they need to do.
OK, I'll give it a go, thank you.
All right. Have a good week.
And you.
See you later.
Bye-bye.
Bye.
Hello.
Hi, come on, Dave.
Hi. Get out.
So I'm Dr. McLaren. It's nice to meet you both.
Yeah.
OK.
I'm here with Evan regarding a bit of a sort of ongoing problem.
OK.
Evan's been on antidepressants, but hasn't been on them for the last sort of 4 weeks. So he's gone back to sort of quite heavily with drinking and smoking.
It's only cannabis.
OK.
I thought, is there any point... OK, I need to be taking the tablets, but if I'm still smoking and I'm still drinking, what's the point of taking the tablets when they're not going to be doing nothing to me? The problems and everything that I had going on seemed like they weren't getting no better.
You know, it's a difficult situation. He's going away today.
Okay.
I'm going to go and stay with my brother for a week to get him away from Bristol. But we wanted to see if there could be, you know, I don't know if it's counselling, a drug programme. You know, there needs to be something.
Yeah. You've mentioned drugs and alcohol earlier on. Tell me what's going on at the moment there.
When I feel low, I'll turn to the drink, have like a couple of cans, and then where I've had a couple of cans, that makes me feel happier in myself.
How much do you think you drink?
Only 4 to 5 cans. It's not like I won't binge into like spirits and all that. Like, it's just
lager.
Like.
Okay. And drugs as well. So
it's only cannabis. I'm only a cannabis user. I've never touched no other
But you've
drug.
been like that since about 18.
16.
Sort of 17, 18. You know, even though as a family, we still support him and try to do what we can. We don't know where to go with it anymore. You know, where do we go as a family to try and get him the help and support he needs?
Have you been in the wars?
I felt
down the stairs.
Oh dear.
Yesterday I was cycling. And then 26 ton of lorry come in. I was in this blind point office. I was on my side.
oh gosh.
I'm running down the escalator and I just tripped and fell.
And in the end, he sort of hit me really bad. Then I just pushed me off my bike.
Yeah.
My bike just got crushed.
Yeah.
Because I broke my ankle bone down there. And I also damaged my knee.
What it is, my hand.
Yeah, what did you do?
I literally fell on it really hard.
My ligament of my little finger went.
Yeah. And have you injured anything else?
Mainly my muscles, my
Okay.
neck and my shoulder.
Yeah.
I think I've done something to my back.
Right, OK.
I've twisted my back on Monday because I work up the hospital.
OK.
And I had an old lady and I tried to make her roll on her own and she didn't.
OK.
So in the end, I sort of ended up pulling the sheet out from under her.
Yeah, OK.
And as I
Okay.
went like that, my back...
Okay. Right, don't do it again.
No.
OK, all right.
And over the past couple of months, I've been getting shooting pains down my back and in my leg, and it's sciatica.
OK.
But it goes, then it comes back.
OK. Has that changed at all?
No.
No. So this is something different that you did?
Yeah, it was
for
just on,
patient.
like I said, on Monday, I was like up and I was rolling this lady from this side of the bed. And I went like that, pushed her, and I was holding her up. And as I was holding her up, I could feel my like pain in my back.
Sounds very much like you've just sort of strained a muscle in your back, doesn't it?
Thank you.
OK.
Yeah,
Let's
it
just
hurt.
have a yes. I'll just have a little look. OK, just to make sure it's not anything else. So it's all on this slightly on this left
It's
side.
on this side. It's
Yeah,
always on
okay.
my left side that
Is
that
it?
the pain is.
OK, all right. And it's tender around here, is it?
Yes.
OK, all right. I mean, you just need to be really careful lifting patients and stuff, don't you?
Oh, yes. Oh, I know that.
Right, OK. I mean, what's going on about your
It's
sciatica?
my age anyway, isn't it? That's what I'm told. And I'm overweight.
Yes, that won't be helping.
No, when my
Yeah.
doctor's left and he said, you're very obese. And you
OK, that
have
was a
to-
polite way of putting
Yeah.
it, wasn't it?
And he said, you have to do something about it.
OK, all right. So are you doing it?
I'm trying, but
It's just
now
awkward.
I'm retired,
It is hard.
I'm starving all the time. I mean, I'm continuously, not being funny,
I
but...
thought you weren't retired, you're working at the
Yeah,
hospital.
I work only part-time.
Oh, I see, OK.
But,
have you got weight, are you doing Weight Watchers or anything like that?
no, because, see, I have depression, anxiety and panic attacks. And I'm having major panic attacks again. They've started up again really badly.
I just wonder whether I should refer you to Weight Watchers or anything. Would you like
I went up to the gym once and...
Once doesn't
No, I had a
usually
panic
work.
attack.
Ah, okay.
Major panic attack. But if I get the hang of it, I would like to go again
Would
to
you
the
like
gym.
me to send you back to the gym?
Yes, please.
All right.
And I will go.
OK, all right.
The thing is, I think because you're depressed, you eat, and because you eat, you're overweight, you eat,
Yeah,
it's a vicious circle.
It's a vicious circle, absolutely.
And I've
yeah.
now got into it that I can't get out.
Yeah, no, that's right.
But
Okay.
I look at people going to the gym and I think, I'd love to go. I really would.
OK, all right, well, brilliant. Let's see if
and
we
I will
can...
go this time.
Good, OK. Let me just...
I've got my tracksuit bottom ready.
Oh, you are just going to be on it, aren't you?
Oh, yeah.
Good morning, can I help?
Hi, my daughter, she's got conjunctivitis.
Oh.
She needs to see the doctor.
I can take your daughter's date of birth, please.
It's the 30th of January, 2011.
13th of January.
14. Oh, my best in the top.
So, what do you think we should do?
Give me some sort of help.
OK. Did you have any particular type of help that you thought would be useful?
I don't know. It's hard because I find if I'm active and I'm doing stuff, it takes everything away off my mind.
So what happened with Rhodes? Have you got their contact number?
Have I got a contact number
For Rhodes? In terms of support, because it looks like you're looking for a bit of support,
Yeah.
they actually quite like the call to come from you. Yeah. Because I guess
instead of them coming to me.
Yeah, well, instead of me saying, you have to go and see them, it shows that that's something you want to do. If you take ownership. Yeah, exactly.
Another thing as well, whilst I'm here, is I've run out of my antidepressant tablets.
Yeah. What do you think we should do? Because it sounds like you weren't that keen to take them. Do you want to try them again?
It's not the antidepressants. It was more of the diazepam that was keeping me happier and more bubblier in a person.
Diazepam, I'm quite reluctant to prescribe. The reasons being it's very addictive, and I guess you've showed that you've had some difficulty with impulse control and with substances anyway. So I feel like I wouldn't be doing you any favours by giving you more diazepam.
Yeah.
But we could think about a different antidepressant to see if that has more of an effect if you wanted to.
I feel like the antidepressants that I was on weren't actually doing nothing.
Okay. Well, let's try something called sertraline. You've not had that one before?
No.
Okay, if I give you a couple of weeks' worth, and then when you come back, you
make an appointment to see a ring doctor or whatever, yeah.
Yeah. I think it's good that you've come in. I think that we do need to make some changes. Some of them will come from getting the right support, and some of them are things that you know...
I need to do myself, yeah.
OK, lovely.
OK.
Do I need to sign it and that?
No, you just take it into the pharmacy. You don't pay because you're on benefits anyway, so...
No, that's what I mean. I've got to
Okay.
tick the box and sign at the back, haven't I?
Yeah.
Right, thank you.
Now, Ken, you're here for your diabetic bloods, yeah?
Yep.
How are you feeling today, all right?
Yeah, not too bad, yeah.
The sun's out today.
Yep. Well, they say sunshine on the righteous, don't they?
Exactly, they do. Don't know what happens all the other days in Bristol, but there you go. What are you doing today? Anything else?
I'm up at the hospital because I'm a voluntary driver out there.
Oh, OK.
That's Southmead.
What, one of those drivers in the little mini golf things?
No. I've been driving for mental health and North Bristol for 26 years.
Wow.
You know.
So do you drive the patients home and stuff?
I drive them home, and also with mental health, we used to have loads of groups outside. But of course, with cuts, all those things are gone.
Yeah. So you've been volunteering for that whole time, have you?
Yeah.
Yeah, all right. Don't they have a cut-off date as well as an age? I'm sure somebody come in and said they had to stop because of their
they
age.
say they're in their 80s, you know, as long as you can walk.
OK, then, that's you finished.
Right, so...
All right, then, take care.
Bye
now.
Right, Mr Newton?
Yeah, thank you very much.
OK.
Go on.
Bye-bye.
Bye.
Right. Yes, all right, well, thank you for looking. No problem. All right, take care. All right, bye.
How can I help?
I've never passed something as big as that, what was on my toilet paper. It's got a little head on with a bit of prongs on, like that.
If he's got his earphones on, it makes it worse.
OK.
Lara.
If you get chest pain like that again, it's really important that you call an ambulance, because it could be a heart attack and that could be fake.
When we know about people's food sticking, we worry about it being a cancer.
Yeah.
It's a background thing that's always there.
So that's not very nice,
It's
is it,
horrible.
really?
It's just scary to think that it might be like this forever.
Stephen Cutler. Hello. Hello.
Thank you.
Come and have a seat.
I've got like a sort of tremor
Yeah.
in my left arm.
Yeah.
I've had for years.
Yeah.
And it started seemingly getting a bit worse. So I just went out for food the other day, and when I was sort of trying to eat, it's a little bit now. When I was trying to eat, it was really starting to shake quite a bit.
Okay.
Sometimes, like, it's absolutely fine.
Yep.
But other times, I can't really put my finger on what it is that makes it happen. I think it might be possibly tiredness, maybe.
So you're 29 now. When did you first notice it?
I generally think I've had it for quite a few years.
Yeah.
I think, but it was so minor, I never really thought anything of it. But I think it's getting a bit worse.
You think it's a little bit worse? And what sort of work do you do?
I'm a physio.
Okay, okay. So what do you think?
Yeah, I know. So I'm trying to diagnose it myself, yeah.
Yeah.
One of the reasons I'm getting it checked is my mum's got MS.
Right.
I've got no other symptoms, but I just thought it'd probably worth flagging out.
Yes. Do you want to just put your arms out like that for me? You have got this. It feels like you've got a fine tremor in both.
Yeah.
But it's more obvious on that side.
Come and have a seat. Right, now.
Today I went to school to pick her up early because she told her teacher that she has got a pain in her private, and they were saying maybe it's a urine infection, so I brought like the urine sample here.
Very good.
Yeah, so...
But I saw you nearly 4 weeks ago with tummy
it was
pain.
2 weeks ago. Yeah.
And you were feeling sick and the pain was in the middle here. Is this the same or is this something different?
Something different. So on the weekends, on Sunday it was starting to hurt, but on Monday it was like I was feeling more pain, and then on Tuesday when I went back to school it wasn't hurting, and then today it was starting to hurt.
Okay, yeah.
Well, let me check that and we'll see. Have you noticed Kira weeing more often or getting up at night to go or anything like that?
No, actually she doesn't wake up at night to go to the toilet for weeing. But she's been complaining about pain in her private. It's been 2 weeks now, so
yes.
I think she has got it.
Yeah, I think she has. Now have a look at this. You see that one there has gone really purple. That is a sign that you've probably got a water infection.
Yeah, water infection is my third.
Any pain anywhere else?
No, just only this part.
Do you want to just lie on my couch for a minute? Let me just feel your tummy.
Okay.
How old are you now?
9.
9?
Yeah.
OK. Show me where the pain is, can you?
This part.
Oh, it's right down there in the poor old... OK. Poor you. Up you get. Well, at least we know what the diagnosis is, probably. You need to take 2 teaspoonfuls 3 times a day.
Okay.
We'll send that to the laboratory and that'll tell us if it definitely is an infection. And then the other thing is they'll look and make sure that this is the right treatment, the right antibiotic. So that's exactly what you had last time.
You have to take this to school.
Take this?
No, the...
Okay.
Medicine, okay.
And then if all your symptoms don't get completely better, we should see you again next week.
Okay.
Well, you'll feel much better in a minute as soon as you've had some treatment. Is that all right?
Yes.
OK,
Thank
and it's a pleasure to have you.
Thank you. Have
All
a
right.
good day.
Bye-bye.
Bye.
This is what it is always like.
Yeah.
Sometimes it really... The other day I was trying to eat some food and it was really like that. And I had to
Yes.
sort of put this hand down and
Yes.
it's really noticeable. I do have a shoulder problem on my left side, that's the only thing.
Right. The other things in my head of tremor can be from thyroid disorder. We should probably do some bloods and just check that.
Okay.
Can I get you to just do me 1 or 2 little things just to look at the cerebellar function? So hand like this. Okay, and now a bit faster. Okay, and then let's do it the other way around. So that hand down that one. Okay. Great. Okay. Next thing I want you to do is to touch your nose and touch my finger. Touch your nose, touch my finger.
Just I can feel it shaking a bit when I do that. Yeah, that's bringing it on, isn't it?
Okay.
It's like a sort of juddery.
Yeah. Okay. So that does seem to sort of exaggerate it.
Yeah.
Okay. Let's see you do that with that one.
I'd say very slightly, but yeah, that doesn't seem...
Okay, okay.
But that's definitely brought.
Yeah.
That's what it feels like.
That's what it feels
when
like.
goes,
Okay,
yeah.
okay. And you don't experience that in your legs?
No, not that I've ever noticed.
Your main worry is around MS?
I wouldn't even say worry, to
No.
be honest. There's just slightly increased chances.
Yeah.
I thought I'd bring it up. So
Yeah,
there's-
yeah.
So if anything happens in the future, we can sort of say, right, OK, well, it started then.
So if we get some bloods done, and then to think about whether we want to ask neurology to see you just to check it out, do you think that you would favour that?
Yeah, that sounds like a plan.
OK. Then why didn't I just do both those things? And then, as you say, it'll sort of lay it to rest, won't it?
Yeah.
Great.
Will do.
OK,
Fine.
great.
Thank you very
Nice
much.
to meet you.
See you.
Bye then.
Practice. No, where you are is a practice. It's a doctor's practice.
All right. It doesn't mean she's going to practice on you. All right. You take care then. Thank you. Bye-bye.
Alan Place. Morning.
Hiya.
Come on in.
Hiya. Well, about 1 month ago, I think I came very close to a heart attack.
All right.
It was as though somebody was hitting me in the chest for about an hour.
Mm-hmm.
I had to sit down for an hour, and after that, I was still shaky for about 2 hours.
Oh, gosh.
And I suppose you heard about the fire.
I haven't really heard about the fire. What?
Well, our next-door neighbours decided to have a burning session next to a wooden fence. And an ember caught on our shed. Our side of the house caught the entire flame because the wind was coming that way.
Gosh.
We had 80-foot flames and 2 tenders. We lost nearly everything.
Just a little listen to your heart.
Breathe away, mouth open. I was watching the television and all of a sudden I realised that my heart was beating really fast.
Mm-hmm. I've been having this palpitation. I'm waking at night time as well and having like, oh.
What is a stethoscope? You can hear my heart. How does my heart sound?
I had a heart attack 26 years ago.
26 years ago?
Well, you've survived that, haven't you?
That's amazing.
No wonder the Victorians died of heart attacks with all them stairs and no lifts.
And I suppose you heard about the fire. We lost 2 cats.
Oh, how horrible. What about the rest of the family? Was everybody all right then?
Well, unfortunately, most of the other kids were out.
How terrifying.
Yeah, it was. I mean, there was just nothing left.
Yeah. How are you feeling about everything?
Well, I'm still shaky.
I'm not surprised.
I mean, I've lost about 1.5 stone.
Can we help from a health point of view with anything in the aftermath after that?
Well, Lynn and I both need full prescriptions, please.
OK, I'll give you some more medicine. When you say that you were worried that you'd had a heart attack, what was the pain like?
Well, it was like somebody just hit me in the chest with a fist.
And then it stayed for a couple of hours, and then it went away?
Yeah.
Do you get angina regularly when you walk?
I get the odd one if I walk a bit too fast. But...
OK, but this was a permanent chest pain that was there all the time. Because you had an echo.
Yeah.
And they said that all looked normal. I guess one of the challenges here is if it happened a while ago and it's not happened since, what do we do about that? It's probably worth us repeating your ECG and the blood test just to double check, because if it was positive, it would change what we did.
Yeah.
But otherwise, I wouldn't want to say what had happened at that point with certainty.
Yeah.
What I would say, though, is if you get chest pain like that again, it's really important that you call an ambulance, because it could be a heart attack, and that might be something really serious. Obviously, that could be fatal if you had an ongoing heart attack that you didn't do anything about. Let's have a look, then. Well, your blood pressure's lovely and normal today. Just listen in here. Your oxygen level is OK, and the pulse is OK, and everything else seems normal.
Right.
And then I'll see you in a couple of weeks to follow up.
Right, lovely. Thanks
all right.
Right, thank you very much.
Bye, then.
Bye.
Have a seat. Well, like your top. Thank you.
How are you?
Oh, I think I got the dreaded lurgy.
Right.
I've come in basically. I've got a couple of things going on. I've had this cough for about 2 weeks.
Right.
Go, and it's all in the nose as well.
Right.
And then also I've got this. I think it's MRSA. I'm not sure. It's done with Dr. Roberts a long time ago, and it's still up my nose, but it won't go. It's not gone yet. I had the cream, but it's still not gone.
First of all, the cough.
Yeah.
Yep.
It's really,
So you've had it for
really
2
painful.
weeks. Are you coughing anything up?
Yeah, greeny.
Right. And when you say it's painful, where
It just hurts the rib cage when I cough.
Right.
It's nothing like major. It's
Yeah.
just
Any temperatures or anything like that?
getting the hot and cold sweats,
Okay.
but nothing.
Let's have a little look. Just check your temperature. And your hair. That's cool.
Oh, I think it's a midlife crisis. To be honest with you about it.
Why not?
Sorry.
Let's have a little listen. Deep breaths. And out. I'll just tap on it. Yeah, I think there's a bit of a sign of infection on the right lower chest. So I think it's worth trying. Bless you. You all right? So I think it's worth trying some antibiotics. So amoxicillin 1-3 times a day for a week.
Okay.
If it's not getting better or gets worse, come back and see us.
No problem.
Right, tell me about the nose.
Oh my goodness, it's been going on for a long time. When you blow your nose and you get sore up there, good old rub in a try and sneeze, and it does bleed, but it's really painful at this side up here. And Dr. Roberts a long time ago took a swab. I think it came back positive.
MRSA is a very common bacteria found on the skin of 1 in 30 people. In healthy people, it causes no symptoms at all and is absolutely nothing to worry about. However, in some people, that bacteria is resistant to antibiotics, and it's this resistance that people worry about, because if they develop an infection, then it's very difficult to treat. And that's where we've heard of the term superbugs, and people get quite worried about it. I mean, we're all going to have bacteria up our noses.
Yeah. They're just falling apart now. Get to a certain age, you see, you start declining, don't you? It's probably not that clear, actually.
Little bit of redness, nothing massive.
Good.
Shall I just give you some sort of antiseptic cream to try on it?
Yeah, anything, really.
Oh, yeah. Right. So, antibiotics for the chest and the nasal cream.
Brilliant.
OK?
Thank you very much.
No problem. Nice to see you.
Yeah, you too. Take care.
Bye-bye.
Hiya.
Hi, so sorry I'm late.
Come on in.
Yes. Over the last couple of months, he started shaking his head
right.
like that.
OK.
And it's getting worse and
Yeah.
worse. He doesn't even know that he's doing it. If I say, stop shaking your head, no, you don't.
What do you think's going on with it?
I don't know. It's
No. Is this what it is?
No, he's doing that on purpose.
OK, when's it happening then?
Well, do you know what? If he's got his earphones on,
Yeah.
it makes it worse.
OK.
Laura.
It does make it worse. When I tell him to stop, he'll do it on purpose.
OK.
But
and what's
other than
worrying
that,
you about
he doesn't know what it is.
No.
Because I don't know what it is.
You don't know what it is?
I mean, I don't know whether it's something major or whether it's something not.
Because I know that he's under the community paediatrician.
Yeah.
And he's not blacking out or having anything else going on.
No, but when he was a baby, he had a massive convulsion fit.
OK.
And he nearly passed, but he was blue.
And is it affecting him in any way?
No, but it's just strange that he's
Just
doing
strange.
it.
Have you got a video of it?
No.
OK. Because from what you're describing, any little sudden movements like this are probably tics. Have you heard of those?
Yeah.
before? Come over here and let's have a look then.
That's it. Thank you very much, son.
Well done.
That tickles.
It tickles.
Good boy.
Just look in the back of your eyes.
I've taken him to the optician.
Yeah, and they were happy, were they?
Yeah, they said his eyes are perfect.
And is he smacking his lips or his tongue or saying anything?
No.
No. Open your eyes really wide, close them really tight. Show me your teeth, blow your cheeks out, blow, give me a cough. Shrug your shoulders, stick your tongue out, left and right. Stand on tiptoes for me. Stand on your heels. That's all great, have a seat. So I think that most likely these are tics, and it's a relatively common condition where kids just move their heads out of habit. I'll write down the name of it for you to go and have a read up about it. There isn't a magic treatment to make them go away, sadly.
No, I just didn't
It's just
know
about
whether it was
recognising that
something
it's a common-
serious. And,
No, it's not a serious problem. It just can be an annoying one.
He doesn't actually know he's doing it when he's doing it.
No.
Only when I tell you. Quite often now.
Yeah. So if you can get some video and then come back just for general follow-up, and then we'll wait and see what happens when you go and see the community paediatricians to follow up for everything else.
Okay, thank
All
you.
right?
Yep.
And,
Thank you very much.
Okay. Nice to see you. Bye
nice
then.
to see you. Come on then, guys.
Boys, I can't stand this heat, not this oppressive heat. No, I don't like this either. Oh, and I thought you can't come out in your summer clothes. It's a bit ridiculous.
It is, yeah, but then what do you do? I can't stand this rain.
The trouble is, it starts raining, it forgets to stop then,
Yeah.
isn't it?
It's awful. Awful
Yeah.
weather.
Come and take a seat.
Thank you very much.
How can I help?
I kind of want to cut down on the citalopram because I feel so spaced out. Basically, I came off my tablets because I ran out and I just split them in half so they would last until I had my appointment.
Okay.
And for the last day or two, I didn't have any left. And I get like a vertigo thing. And it's horrible.
Yes.
And now I'm like, I have to come off these things because it's shown me how like dependent I've become on them.
Okay, maybe we should tackle the anxiety in a different way.
Yeah.
We could lower the dose because when you say this sort of spaced out feeling, it can take the edge off things a bit too much sometimes.
Yeah, I think
So-
that's what it's like. It was good when I needed it.
Yes.
But now, you know, I've changed jobs. I'm nowhere near stressed out as I
Good.
was before.
Good.
And I feel like a lot calmer and I feel more in control of my anxiety as well now.
Which is great.
Yeah.
So one option is that we reduce it, and in the background, I don't know if you managed to get any counselling or access what we call Bristol Wellbeing Therapies. You can self-refer,
Okay.
and longer term, because you're only, 27, you'll find that the anxiety at times is fine, and it might just be fine because you've changed jobs,
Yeah.
or maybe doing a little bit of work on it, so...
I think that'd be really good because it's like, at the end of the day, even though I'm feeling better, I still have this constant worry that I'm going to flip back.
So
And
there's
it's not like it's a background thing that is always there.
Yeah.
Like, every minute of every day.
So that's not very nice, is
It's
it,
horrible.
really? So actually, if we could make that better for you and have sort of strategies in place so that it's tackled well.
Yeah.
Because I can see you're getting emotional about it,
Yeah.
you know, and longer term, that would serve you really well.
It's
But-
just scary to think that it might be like this forever.
Yeah, you won't. Once you're armed with certain things to help you, it will serve you well all your life. What dose are you taking at the moment?
40.
Then? So what I'm thinking is that we reduce it to 30 milligrams
Yeah.
for a couple of weeks,
Yeah.
and then reduce it to 20.
Yeah.
And things okay at home? Things okay with your relationship?
Yeah, really good.
Because you've been
Really,
together
really
for how long? Remind me.
Like 3.5 years.
Yeah, so that's good.
Yeah, we've moved in together.
Okay, good.
And he's bought me a cat.
Right. Okay. That's therapeutic as well. You know.
Honestly, it's worked a dream.
Well, that's fantastic.
It's so calming.
You might have to have some in the waiting room.
Yeah.
So have a look at this. Okay,
Thank
Harriet.
you very much.
And I'll touch base with you within 4 to 6 weeks.
Okay.
All right.
Thank you so much.
That's all right. Good.
Thank you. Have a nice day.
You too. Take
Thanks,
care. Glad the job's
bye.
better.
Oh, thank you.
Bye.
Bye.
Oh, we've got a baddie fan. What have you done?
Hamster bear.
Your hamster? No, that's a naughty hamster, isn't it?
Guys can't stand him.
What'd she say? She wants Daddy to stand on him.
Oh, no, I'm not so sure about standing on him. Perhaps we can tell him off.
Okay, so she's got a problem with eating, or
Just eating.
just eating. Okay, it actually comes back. She actually vomits,
Just throws up.
throws it up. How long has this been going on for?
Maybe 4 or 5 minutes.
This is quite a worrying symptom, so we need to really think carefully about what we're going to do. Okay. Is it causing pain?
Do care for that?
No.
There's no pain. There's no you know what I mean by indigestion symptoms? Does she get those?
No.
Nothing?
Nothing like that.
I think I'm going to need to get her up on the couch, OK? If I can work out this bed, I'm going to lower it. Oh, look at this. This is magic, though. I haven't got a fancy bed like this. That's good for her. So I want her to lie down. Yeah, OK. OK. What I want to do is just feel your tummy, OK? Any pain now? No? Lovely. OK, right, we'll get her up again. You want to just come and...
Yeah.
I'm just having a quick look because about 10, 12 years ago, we found that she had this thing called a hiatus hernia.
Okay.
Yeah? Do you remember? In 2005, I wrote, intermittent difficulty swallowing solids, food sticks, she brings it up.
Yeah.
OK?
Yeah.
Exactly the same now.
Then, yeah.
What happened then was I did an urgent referral and she had that endoscopy.
That's right.
OK?
Yeah.
That is an option today, all right? I'm not sure how much she would want that. What happened then was she had this bug in her tummy, I don't know if you remember, and she had antibiotics, and she also was then given other medicines, and she actually gained weight and it all settled down. OK, so there's two possibilities. This is the same problem, come back again, in which case we could do that test for that bug again and then give her that treatment if it was positive and see what happens, OK? The risk with that is that when we know about people's food sticking stuff, we worry about it being a cancer.
Yeah.
OK?
Come on, darling. Right. Do you want a hand? Take your time, take your time. I'll just help you onto this.
Do you think you could hold him just for a sec?
Do you want me to help you move it up?
Yeah, moving it is not a problem.
OK.
Knee is swollen.
Thank you.
Thank you, Dr. Lee.
It's quite all right.
Do you want a hand?
Yeah. Can you just pull it that way from me?
Yeah.
Oh, Jesus, wow.
There we are.
Thank you.
The only way I would know it was a cancer would be to get that endoscopy thing again.
OK.
OK? Yeah. I can do that, but she is very frail, and we've had lots of conversations about she doesn't really want tests and things. Would you like to just have a little talk with her?
OK. I will explain to her.
Yeah, OK. You have a little chat and I'll go and do what I need to do, OK?
Toilet name
that test. OK. Have you...
I
OK.
explained that to properly.
You even used the word cancer, yeah?
I did. I said I can use it again. I said the possibility of cancer, but...
Yeah. I don't think that that is unreasonable, OK? Because of what happened before.
Yeah.
In that case, then, I'll keep an eye on her, and we can always have that conversation again. And if she changes her mind at any point, you can just phone me, OK? So the first thing we need, then, is a poo sample. Today, if possible, otherwise Monday, OK? I will be giving her some tablets, but I need to wait for this result to decide which tablets to give her. Is that OK? All right.
I'll try to bring it today, otherwise Monday, yeah?
Wonderful, yes. And then keep in touch with me, let me know what's going on. We can speak to make sure we got the right prescription organised, but then I should probably see her in about a month or so.
Okay. Shall I make an appointment after a month?
Yeah, yeah. OK?
Thank you.
She got any questions?
Okay, question, which one? No, she's okay.
OK, all right, thank you very much. OK, bye-bye.
Bye.
Bye. Bye.
They look comfy, those shoes, Sally.
Do you know, I got them out of the wardrobe this morning, I bought them, and I found this skirt in the wardrobe. I thought, that actually will go. And they're really lovely.
But as long as you get, like, wedges, they are really comfy.
Morning.
Morning.
How are you doing?
I'm fine, thank you very much.
Because I know that, with all the stuff with your cancer and the difficulty swallowing and...
It's improving. I still have difficulty. But you try, Yeah.
Do you think it's getting better then?
It's going to be a long haul, Tom.
Sure.
We ain't at the steak and pizza stage yet, unfortunately.
David has had a cancerous tumour at the back of his mouth in his gum, and he's been under the hospital specialist for the last couple of years. He's needed an operation to remove this tumour, and unfortunately, this has affected his sense of taste and his swallowing. And this was part of the reason that he came to see me. Are you able to enjoy your food in any way?
Not as much as I used to, not by any long stretch. And it's very frustrating.
I bet.
Because I exist on a soft diet, but, you know, you try.
Sure.
It's not going to beat me.
Well, that's the most important thing, and I'm glad to hear that. How much are you drinking at the moment? Is that...
Professor Thomas said I'm drinking half a bottle of vodka a day. Now, that's a slight exaggeration.
How much do you think you are drinking?
Well, quite considerably less.
Oh, good. Well, well done.
It's a variation on the drink that I used to drink in Spain, La Mumba, which is chocolate milk and brandy. But I've had some vodka, so I started off with vodka. It's just to take the sweetness away from the chocolate milk. Like, you have to dilute the chocolate milk. I can't take it neat. I'm not man enough.
No.
Right, what can I do for you?
I have something in my throat.
Right.
So it just feels really weird. The first time I felt it, I've had like a toffee sweet and there was a tiny little bit left and kind of, you know, when you've got something sort of stuck and I was driving, I kind of panicked, just, oh, it's stuck in my throat. Yeah. And it stayed there for a while, I didn't think much of it. Obviously, eventually, it probably melted away. And then again, I was just having a piece of toast. Yeah. And it felt like, oh, like I scratched it quite badly and then I can just feel it ever since. And it's just constantly there. So it makes me think it's not really something stuck, it's more like there's... Sorry, I'm just turning...
Right, I'm glad it's not mine. I was thinking if I turn mine off, mine is turned off. Yeah, no, that's fine.
Yeah, and it's just constantly there. It's kind of annoying and a little bit worrying.
Sure. And what sort of time frame?
Well, the first one, probably about a month and a half.
Okay, yep. Are you otherwise fit and well?
Yeah.
No weight loss?
Not really.
And do you smoke? No. Do you drink much alcohol?
Not much, but yeah, I'll probably have a glass of wine every couple of days.
Okay.
So we all do.
Yes. Okay, and in terms of family history, anything significant?
My mum had ovarian cancer.
Right.
Oh yeah, my mum had is it thyroid operation?
Yep. Okay. Can I have a little feel of your neck?
I mean, I kind of thought I felt a bit dizzy a few times, but I've been so tired.
So there's no lumps or anything?
Yeah, it's kind of round there.
Round there. I wonder if your thyroid gland is a little bit enlarged. OK, let's have a little look at your throat. Sorry.
I got my jaw kind of locked.
Ooh, oh, gosh. Sorry. Great party trick.
It does sometimes.
Oh, dear. That looks fine. Just wash my hands. A bit unusual. I think we definitely need to look into this. Probably an ear, nose and throat referral, to be honest, because I think they're going to have a little look down with the camera.
Yeah. A bit further down.
Yeah. I just wonder if I refer you for a scan as well as for your thyroid. And you're saying you're feeling quite tired?
Yeah.
And is your throat sore with it at all?
Now when I'm talking, I can feel sort of... I think there's something there, it's sort of moving.
Right, OK. I'm going to refer you under what we call the 2-week wait then, which is to rule out anything nasty like a cancer. I think it's unlikely to be a cancer in your age, but we want to check it out for sure. So I'll refer you, you'll get an appointment in the post within 2 weeks. If you don't, please let me know. Let's check some bloods in the meantime, OK? And I'll refer you for a scan of the thyroid as well. Is that all right?
Thank you.
OK, all the best. No
Thanks
problem. Bye-bye.
Cheers.
So how much vodka do you think you're getting through a week?
I reckon a bottle would probably last me at least 3 days.
OK. So that's a couple of bottles at least a week?
A week. Which is, for me, quite good.
Well, it may be for you good, although it's still quite a lot higher, as you know, than the recommended levels. And given your previous cancer and things like that, I know that you've been told this before, and it's important for me to tell you again that could be dangerous or damaging for your health.
Yeah, this is, I think, possibly part of the problem, because I don't think it's a problem.
We can offer support and help to stop if you wanted to.
Well, yeah.
And then ultimately, it's up to you, isn't it?
If I find
it's your choice about what you want to
getting
do.
on top of me, you know, you'll be the first port of call.
Well, good, I'm glad about that.
If I have previously been diagnosed as a dry alcoholic.
Right.
Do you know what that is?
No.
It's someone who gets their gratification from seeing people drink.
Right. I've not heard that phrase before.
No, neither have I. So if I need any gratification, I watch people in the pub.
Well, maybe that would be a way of just cutting down a bit. Buying lemon... OK, so...
Right, so I'm going to book in a blood for, I think, about 7.
Perfect.
And you've done the...
And I've sent the medicines all over, so there's a new batch that's all gone over to the chemist. Well, nice to see you, and I'll see you in a couple of months' time when we'll have the results of those tests.
Yeah, OK.
All right, nice to see you. Bye-bye.
Bye.
But I haven't seen a diabetic nurse for over 6 months.
Oh, we better get you in.
Yeah, you better.
There'll be trouble otherwise.
So, Emma, have you got one of these already, or is this a...
Yeah, I've got
Yeah,
one
you have.
already. I found out that it was supposed to have been out in March.
Fine.
So I moved her a little bit.
So we really need to put it in your other arm now.
Right, OK.
Because nowadays they say to us after 2 we should switch to the other arm. So given that we know it ran out in March...
Yeah.
Have you...
I've done a pregnancy test first thing this morning.
OK.
And it was negative, so...
When did you last have sex?
About 4 days ago.
Using protection?
No.
I mean, I'm happy to replace it.
Yeah.
I can't be 100% sure that you're not pregnant, but from what you're saying to me, you don't want to be pregnant.
Oh, God, no.
No, then we need to get this one into you so that you've got good ongoing contraception again. But we should still do another pregnancy test in about 3 weeks' time to just be absolutely sure. What I want you to do is to use condoms for this next week if you have sex, just because it would take a week for a new one to work.
Right, yeah.
So...
Sorry.
Oh.
Transferring off because it's going to do it again.
Is it going to do it again? OK. Lovely. OK, right. Do you want to come and hop yourself up on here?
Oh, God.
Pop that there. A little bit of cold and wet just on your arm to clean it. Sharp prick coming? No, fine. Let's get it in. And then we're just going to... Great, so that's that one in. That's great. OK. Just going to sort this trolley out, and then we'll start again on the other side. OK. You ready?
Yep.
Just feel it. That's fine. It's coming out nicely now. It did need a bit of a pull, didn't it? Yeah. That's out there now. Lovely. This dressing is to stay on for 2 days.
Yep.
And the bandage for 24 hours. OK. Both arms.
Is that one done?
Oh. What have I told you about when you can rely on this? Can you remember?
No.
OK, so rely on it until it's been in for 7 days. And then a pregnancy test?
4 weeks.
Perfect.
Thanks.
Bye.
Bye.
Welcome to your home. So kiss your butt. Can you kiss your butt?
Well, I'm very pleased to see that your lung function tests are OK, Sylvia.
That's brilliant, isn't it? Yeah.
You probably got a lecture about stopping smoking to stop problems in the future. But, you know, you are 74 now, so...
Am I that age, really? Sorry.
What I mean is that...
No. I know where you're coming from, you're right.
How many is it a day? How many cigarettes a day?
It's round about 20. Some days I do and some days.
So if we kept it, say, at 15...
I am trying now.
That would probably help. You could save about £3 a year, then you and Terry could go on a holiday and get some sunshine.
I know.
That would be better. But your chest X-ray, they said that there may be a little bit of infection at the bottom of the left base here. It's called atelectasis, which isn't quite infection, and what they said is to check your x-ray again in 6 weeks to see if that's got better.
But the other ongoing problem, there is still something in my toilet.
With the stool side of things, I think we've covered that a lot. That's been, your whole gut has been checked.
But I passed.
Your samples, everything.
But there is something attacking my system like a worm, and I think this could be...
Yeah, there's nothing attacking your system.
It's not imagination, because it's there in my toilet. You know, women wipe themselves, don't they? And
Yeah,
they
yeah.
fold their paper. That's the only
So what,
reason
do you feel itchy down below? Do you feel you've seen any worms?
No.
No.
Yes, I do see something. It's got a little head on and with little prongs on, like that.
I feel strange. I've been weeing a lot this morning. I've had about 7 wees.
And you were getting some blood in the urine. Has that happened?
Not that I notice. I mean, I don't always piss in a loo.
Okay, I won't ask any further questions on it.
I'm going to Thailand in 4 weeks. I've been told I need to get some injections.
You haven't been to the toilet in 4 weeks, is that what you said?
No, sorry. I'm going to Thailand.
You're going to Thailand?
I have been to the toilet.
Sorry, misheard you there.
I've never passed something as big as that. Well, it was on my toilet paper. You know, if you say the size of a broad bean, that was the size what I've got home in the jar. But because it's in a little honey jar, it's now going furry.
Okay.
So I was going to bring it up to you, but it's too embarrassing to bring it up to you.
Okay.
But it's nothing I'm eating because I don't have broad beans, and I haven't had broad beans for a long time.
But the previous stool samples have also been checked and looked at, and they've been fine.
Well,
I think
don't
what
know.
might be a better thing we can do a stool sample is that if you took a picture of what you're describing and bring them into me next time.
Yeah.
You seem very focused on the gut always.
But would it be because I had an ulcerated stomach years ago? I didn't...
Yeah, no, not related to any of that.
No.
There's nothing parasitic or worm-like in your gut that's causing you a problem. Okay?
I'm afraid to turn around and say, because before, like with Dr. Drew, he'd put everything down as a mental issue, which it isn't a mental issue.
Apart from sort of looking at the psychological aspect of it, we've also physically checked your gut.
Yeah.
Okay? If it happens again, you can get a stool sample pot from the treatment room, and we can check it once again and send it off as we have done. So for now, don't forget to go along for your chest x-ray that we talked about.
Oh, I will,
Yeah.
yeah.
And I'll see you back, and we'll go through the results of all of that. Is that okay?
Yeah, that's
All
fine.
right,
That's
good.
lovely.
All right? Good.
So you're finished with me now?
Yes.
You don't need me anymore.
No, that's all right. Thank you. Take care.
And you.
See you soon.
Bye.
Bye-bye.
It might be just going nutty as I'm getting older.
Why don't we talk about that? We'll talk about all your concerns, okay? Take care,
Thank you.
Sylvia. Bye-bye.
Brilliant, that's really good. Yep, that sounds a lot better, actually.
I would say generally it is getting better.
Sure.
I definitely feel I'm on a bit of an upward swing.
It's good to hear. Doc, I really want to get better.
And I think that you are getting better.
I think you're
On
an
the
inspiration,
whole,
actually, of how well you've done.
I just try and keep myself busy.
Take a seat, hon. So, 2 days in Devon, so you look really well on it.
Yeah.
And how are you doing?
Really well.
Yeah. I would say watching you walk in, you looked really good.
Yeah, I've...
That's amazing.
I'm trying not to use a stick.
Yeah.
Which does hurt my hips, but I found I was going like that. I've been taking omega-3, 6 and 9 and multivitamins.
Brilliant.
I've been swimming or doing aquarobics 3 times
You
a
look
week.
a different person today. It's quite
I've
astonishing.
lost 10 pounds as well.
Amazing.
So I'm just trying to be positive now.
Nicola's got quite a complex past medical history. She suffered with Hodgkin's lymphoma back in 2014, which required treatment with 6 cycles of chemotherapy. And she did really well in terms of the response clinically to the chemotherapy from the Hodgkin's point of view and went into remission. But some months after she'd finished her chemo, she developed initially quite bad back pain, and that went on to become more chronic and more generalised. And over the last few years, she's developed a condition that we call fibromyalgia.
I'm still in a lot of pain, but what I find is when I get in the water, I just feel like me again. I just feel normal.
It's a bit like when I remember being pregnant, swimming. I love swimming in pregnancy.
I just love swimming.
But it's a lovely meditative thing to do,
Yeah.
and it's, well, not if you're surrounded by lots of kids in Europe, but, you know, it just removes gravity.
It's something I could do before, so...
Yeah. Well, I'm really impressed.
Yeah, my son decided to go camping in Woolacombe.
Oh, fantastic. Well, would you have even contemplated to have gone camping a year ago?
I did struggle, but I loved every second of it. So I think mentally, I'm feeling a lot more positive.
But also, we know that exercise helps with pain. We know it. You know, over time, it helps remodulate
and
sort
I
of
know
pain centres and
losing
things.
weight is bound to help.
Yeah.
So my big aim now is hopefully to get back to work by the end of the year.
Just remind me what you're doing, because I can't remember.
I'm a school cook.
Yeah, that's it. So it's really physical, isn't it?
Yeah.
Well, I'm really impressed. That's brilliant news.
I'm feeling good about myself as well. So
where are we with the medication?
Right,
now,
with the
then?
medication, I'm taking 2 of the morphine a week, and I was
that's
wondering
all
if I
now.
could stop them now.
Yeah, I think if you're down to 2 a week, you can. I know that was something you really wanted to do, wasn't it?
Yeah.
And then, so in terms of the pregabalin, what do you
Well,
want
I'm hoping I can up that a little bit.
Yeah. So you're now taking what dose? Is it 225?
225.
Twice a day.
Yeah.
So I guess, and again, I mean, some doctors would ramp it up quite dramatically. I prefer not to. I mean, it depends on what you want to do. 'cause
No,
I
I'd
think
rather do it bit by bit because it also encourages weight gain, and I'm really trying hard to lose weight now.
Exactly.
So
That's a really good point.
little bit at a time would be.
Well, I guess the logical thing would to be go up by another 75.
Right. Okay. Well, thank you very much.
Wonderful to have met you.
Yeah, and you. Thank you.
You've
been amazing.
Well, you're doing amazingly.
We're doing amazing between us.
Good team. Okay,
All right,
Millie. All the
thanks
best,
a lot.
Nicola. I wish you all the best. Take care, Millie. Bye.
Say bye-bye.
Bye.
Bye-bye. OK.
Thank you very much.
That's a pleasure.
Say thank you very much.
Thank you.